Hey everyone, welcome to this episode of the Powered by Iron Health podcast. We are here to create a community that raises the standard of health and wellness. I will say that too, I'm blue in the face because that's our vision. That's what I am gung-ho on. That's what our company's gung-ho on. And that's what we want to achieve. So today, we're going to talk specifically about chronic injuries and really how to deal with them, how to manage them, and what you should be doing on your own and what you should be doing externally to get the best out of it. So I have you learn from yourself most of the time, and I have a slew of injuries. I played football up into college, so I have a number of injuries from that. One of them really stems from my left arm and my left shoulder. And one practice, I was going to make a tackle, and I actually had a complete elbow blowout, which pretty much means I was going to make a tackle, and someone hit me from an angle that bursted a ligament in my elbow. I don't need to get the specifics of it, but it was the injury that happened. Till this day, I'm still suffering from the repercussions of that. I think it's important to note that especially if you were a former football player, you're going to feel it when you're older. I'm in my 30s now, and those injuries just stack up. That's another side thing. Your injuries stack up. Once you have one, you got to manage that the rest of your life. So specifically to my injury, I had this elbow issue. I opted not to do surgery, which means that I did not have it repaired. So now I'm functioning without a UCL, which is a ligament in the elbow. And what that means is that a lot of the muscles in the area have to surround it and help protect me from certain motions. That also means that the nerves that run there are affected. Now, one thing I've noticed throughout the years, if I'm in a posture for an extended period of time, if I'm doing an exercise that may be a lot of stress on my left arm, I consistently feel it in my arm and my shoulder, right? This whole chain is connected. So this is something I have to actively manage on a daily, weekly basis to make sure it doesn't get worse. And the same is true for any chronic injury. And we'll talk specifically to chronic injuries because the most common chronic injury is lower back pain, which I think is an elephant in the room that we have to address. And the other is something like me, if you had a previous injury when you were a little younger, or a muscle strain or a muscle tear, or let's say you're a runner, you had hamstring tears, it's important to address that as well. So we'll start with those and then we'll go to the lower back pain. So if you've had a previous injury, let's talk something like me, my elbow or my shoulder, where one time when you were a little younger, you had a fall or you got hit in a sport, or something of that nature, or you were bench pressing and you tore your pec. Once you have that injury, now this is something that you have to manage pretty much the rest of your life. There's a couple of reasons for that. One, as tissue regrows, it doesn't really regrow to the level that we want it to or to the normal level. It's completely normal. Scar tissue builds up, and sometimes you want scar tissue. Sometimes you get adhesions in there that are necessary. You just have to work on them. So how do you, as a consumer, affect your chronic strain or tear? There's a couple things you need to do. One, you have to actively work on the tissue, okay? Muscles like the quads, the hamstrings, the pecs, these are massive muscles that are pulling on a lot of joints. If you had a strain there, it's going to eventually affect the joint. So you have to actively be working on that tissue all the time. Let's hone in on one example so I can give you specifics of that. Let's say you had a chest tear. You were doing a bench or a push-up, or you fell and you had a pec tear, which is the big muscle in your chest. Now, you could have gone through rehab and it got back to a normal function. That doesn't mean the tissue is functioning at its max capacity. You need to consistently manage it. So you need to do some sort of tissue work. You can use a foam roller, you can use a massage gun, you can use a lacrosse ball or a tennis ball, consistently getting in there. You need to also make sure that you are warming up efficiently. So these are two basic things you need to do if you have a chronic muscle strain. So when you're in the gym or prior to you doing any activity, you need to be making sure you're warming up and getting blood to that area effectively. Because there was once micro tears there now, and they're not as strong as they once were. You need to make sure blood is circulating. We don't want stiffness. We don't want anything clogged up in there. So an active warm-up and tissue work are essential in that area. Now, those are basic things. Those are the baseline level you need to be doing on your own. The floor, the floor. If you had a chest tear, if you're not consistently working on your pec and getting it warmed up, getting your joints warmed up, you're asking for an injury in the future. Okay, so that's like a base level. Now, if you have that same condition and you are more competitive or you are a weekend warrior, you also need to be doing some sort of maintenance with a provider. So what do I mean by that? If you're not going to a massage therapist once a month, a PT, a chiropractor, choose your provider to actively get it worked on, you're doing yourself a disservice. Because sometimes you can only take it to a certain level. You need some external feedback or external intervention to take it to the next level. So it's super important that you have a repetitive provider on your schedule so you can consistently follow up. Some people like massage, some people like PT, some people like chiropractor. That is for you to choose. It's just important if you are active and you want to consistently be active and you had an injury in the past, you consistently get it worked on. So that's the basic tenets of like a low-level basic chronic injury. Now, another layer to that too is also to make sure that your movement hygiene is good. And what do I mean when I say that? If you go to someone who's a qualified professional, they should be looking at your movement as a whole, from your neck down to your toes, just to see if there's any extreme abnormalities that need to be worked on. Because once you have movement asymmetries and abnormalities, when you go to load something on it or try to get strong in that area, you're asking for a potential injury. So you have your basic, like, focus on the issue or the injury that you had, and then make sure your movement hygiene is good. These are two basic tenements there to make sure you're going to keep evolving and progressing and doing what you want to do. Now, something like a chronic low back pain, as I alluded to before, is really a monster of a subject in the physical therapy world. We see a lot of variables that go into chronic lower back pain, right? So as an orthopedic specialist myself, I do look at orthopedics, meaning I look at movement, I look at the joints, I look at the tissues. There's a whole nother layer too. And it really is the psychology of it. Pain is definitely affected by the way you think. So it's important that you're also talking to yourself a certain way, maybe talking to a therapist or someone to help you navigate how you think about pain and the way you see it. Chronic lower back pain especially. If you've had chronic lower back pain for years, it's important that you're conversing with someone. And just know you're not the only one suffering from this. There are a ton of people like this, and you can get support through the process. At the end of the day, the key is movement. Don't stop moving. Keep pushing yourself. If you feel yourself talking to yourself a certain way, try to shift it. The language matter is very important, right? It creates patterns in our brain, which creates pain cycles in our body. So we need to make sure we're also conversing with ourselves that way. If you are trying to take it to the next level, get it on your books, get help consistently, make sure you're managing it, and talk about it. Don't suffer in silence. So go take care of your chronic pain. Thanks for listening.